Assalamu alaikum. Bismillahirrahmanirrahim. Today we'll discuss aplastic anemia and red cell aplasia. Now, aplastic anemia refers to a syndrome of chronic hematopoietic failure. There is a failure of hematopoietic stem cells in the bone marrow that results in decreased production of all the cells, that is red cells, white cells and platelets, resulting in pancytopenia. Pancytopenia is the term used when all the cell lines are decreased in the peripheral blood, that is the patient suffers from anemia, neutropenia and thrombocytopenia. So there is suppression of the bone marrow stem cell resulting in decreased production of all these cells. Now, bone marrow failure could be due to many reasons. One is the aplastic anemia, which is a reduction in hematopoietic stem cells. Aplastic anemia due to aplastic anemia or chemotherapy also results in decreased production of hematopoietic cells, or sometimes there is replacement of the normal bone marrow by the malignant cells, for example in the case of leukemia, lymphoma, or it may be due to metastasis from a primary tumor. It may be due to ineffective erythropoiesis, for example in the case of megaloblastic anemia and myelodysplasia, or it may be due to infiltration of the normal bone marrow by myelofibrosis, for example in myelofibrosis and amyloidosis. Now, this aplastic anemia results in decreased production of the hematopoietic cells, resulting in decreased production of platelets, thrombocytes, red blood cells, RBCs, and white blood cells. Now, etiology of aplastic anemia: in the majority of patients, it is autoimmune, and sometimes inherited or acquired abnormalities of hematopoietic stem cells is also suspected. Acquired includes idiopathic, that is cause is not actually known, or it may be due to acquired stem cell defect, or it may be immune mediated due to chemical agents, dose related alkylating agents or antimetabolites, benzene, chloramphenicol, or inorganics. Or it may be due to certain drugs such as chloramphenicol, phenylbutazone, carbamazepine, and penicillamine, etc. Now, it may be due to physical agents when there is irradiation of the whole body, either due to therapeutic purpose when the patient is receiving radiation due to treatment of carcinomas, or it may be due to nuclear radiation or viral infections such as hepatitis, cytomegalovirus infection, Epstein-Barr virus infection, herpes zoster, or sometimes it is inherited. Inherited is due to Fanconi's anemia and telomerase defect. Now, what is telomere defect? Telomere is actually, they are found at the end of the chromosomes, which are responsible, from where the replication of the chromosome occur. Now, telomerase actually limits this replication activity, and these telomeres, they get shortened as the person ages. With the time, it gets shortened. But sometimes there is defect in the telomerase activity, which results in premature hematopoietic stem cell exhaustion and marrow aplasia. And sometimes there is mutation in this telomerase, which results in abnormally short telomere, which is found in the marrow cells and results in aplastic anemia. Now, this diagram shows normal telomere resulting in hematopoietic stem cell, normal formation of hematopoietic stem cells, and normal production of platelets, erythrocytes, and white cells, and short telomeres resulting in decreased production of white cells, red cells, and platelets. Now, pathogenesis, there are actually two etiologies of aplastic anemia. It may be extrinsic, immune-mediated suppression of marrow progenitors, or intrinsic. Intrinsic is there is intrinsic abnormality of the stem cells. Now, in order to be defective hematopoietic activity, the stem cells should be first antigenically altered by exposure to drugs or infectious agent or radiation or whatever is the cause. They become antigenically altered, and then it provokes an immune response, during which the activated T cells results in the production of cytokines such as interferon and tumor necrosis factor, and this suppress and kill the hematopoietic progenitor. Now, what will be the morphology of peripheral blood in the case of aplastic anemia? The red cells are usually macrocytic, slightly macrocytic and normochromic, and since the bone marrow is not functioning normally, so RBCs are produced in a very low amount, and reticulocytes are not normally produced, so there is reticulocytopenia, which is always found in aplastic anemia. Now, this is the peripheral blood film of aplastic anemia. You can see very few RBCs. There are no platelets seen in this blood film, no white blood cells seen, and RBCs are also far apart, and they are normochromic and slightly macrocytic. Now, the bone marrow is hypocellular, and it is devoid of hematopoietic stem cells. Very few hematopoietic cells are seen in the bone marrow. Usually fat cells are seen in the bone marrow, large amount of fat cells, fibrous stroma, and there are scattered lymphocytes and plasma cells in the bone marrow. And when the bone marrow aspiration is done, a dry tap is found. That is when the syringe aspirates the marrow, the marrow is not found in the syringe. That is called a dry tap. Now, this is a normal bone marrow showing a normal amount of hematopoietic cells. These are actually the precursors, erythroid and myeloid precursors that are seen, megakaryocyte, erythroid and myeloid precursors seen in the bone marrow, and they are normal amount, that is usually it is more than 30%, 30 to 70%. Here, Jimsa stain of the bone marrow shows decreased amount of hematopoietic cells in the bone marrow, large amount of fat cells in the bone marrow, and you can see that fatty marrow is more in this picture, and hypocellular bone. Now, this is also a bone marrow picture of aplastic anemia showing hypocellularity of the bone marrow, and it is stained by hematoxylin stain, and very few lymphocytes, plasma cells are seen in the bone marrow scattered within the marrow. Now, this is trephine biopsy. Trephine biopsy, that is biopsy of the bone marrow is done. A piece of bone is taken out, and you can see bony trabeculae. Within bony trabeculae, there is hypocellularity of the bone marrow. Usually, fatty marrow is seen. Very few cells are. Now, this is a comparative picture of normal bone marrow and hypocellular bone marrow. On the right side, you can see normal bone marrow of trephine biopsy of the bone marrow. Within the bony trabeculae, you can see hematopoietic cells and fatty marrow, few fatty marrow. Whereas in the hypocellular bone marrow, mostly fatty marrow is seen, and very few hematopoietic cells are seen here. Clinical features: aplastic anemia can occur at any age and in either sex. Onset is usually insidious, and there is progressive weakness, pallor, dyspnea, and thrombocytopenia, white platelet count is decreases, then there may be petechial hemorrhages, pinpoint hemorrhages in the skin and mucous membrane, and ecchymosis may be found in the skin. And sometimes if thrombocytopenia is severe, then mucosal bleeding can also be seen, and neutropenia results in infections, minor infections, since white cell count is prevent from infection, and it is essential for the acute inflammation. Splenomegaly does not occur in the case of aplastic anemia. Clinical features: the prognosis is variable, and bone marrow transplantation is the treatment of choice if suitable donor is available, and it results in 5-year survival over 75%. Lab diagnosis: bone marrow aspiration is done, bone marrow biopsy is done, but trifine biopsy is diagnostic for aplastic anemia. The trifine biopsy is done to diagnose the cases of aplastic anemia. So this was all about aplastic. Now red cell aplasia, pure red cell aplasia. In pure red cell aplasia, only erythroid progenitors are suppressed. In aplastic anemia, we have seen that all the cell lines are decreased, but in pure red cell aplasia, only erythroid precursors are, and it may occur in association with neoplasm, particularly thymoma and large granular lymphocytic leukemia, or sometimes drug exposure, autoimmune disorders, and parvovirus infection. Parvovirus 19 infection results in red cell. Okay, thank you for listening the lecture.